I'm Kyra Mann, CEO of MitoAction, and I want to just welcome everybody to today's 2020 Mito Town Hall meeting, where we'll hear from members of the Mito community about what's coming in 2020 and highlights from last year. Before we get started, just a few housekeeping items. All of our presenters are muted, so please unmute yourself when I introduce you and it's time for you to present. All attendees and participants will be muted throughout the call, but if you have questions or need to reach us during the call, please use the Zoom chat feature at the bottom of your screen, or feel free to email us at info@mitoaction.org. Today's call will be recorded and available later today on the MitoAction website at www.mitoaction.org. We will also have a written summary that'll be available in the coming weeks on the MitoAction website. So it's hard to believe that a year has already gone by since we were last all together, but we're excited heading into 2020. I know this has been a difficult few weeks for the community as we've learned the results of the elamiprotide trial, but I hope that everyone can leave here today knowing that although the results of the clinical trial weren't what we had hoped, there will be others, and there's so much positive work and research being done for the mitochondrial disease community. There are so many great initiatives in the works and great things on the horizons. The patient advocacy groups, clinicians, researchers, and individuals who all work tirelessly to support our families, we will never be diverted. Together we will get through this challenge, and together we will continue to press forward to get closer to treatments and a cure. So we have a full agenda today, and we're looking forward to hearing from the various organizations within our community about their plans for the upcoming year. So to kick us off, our first speaker will be Paul Hardy, President of MitoAction Board of Directors. Paul has been involved with MitoAction for more than 10 years. He is an incredible champion for the Mito community, and Paul and his wife, Sarah, give tirelessly of their time and energy to ensure that every family on this journey knows they are not alone and has the individualized support that they need to face each and every day. So please join me in welcoming Paul.
Thank you, Kyra. I would add you to the list and all of your team of the people who give tirelessly to the Mito community. And I think actually, I'm sure many people who are also on this call, the volunteers, or all of you who are participants in our events, you know, community is truly what we are. I think we define that. So I thought I would just kick off by just, again, thanking everybody for all of that. First and foremost, the community to me, I have a very emotional and long relationship, as you mentioned, to MitoAction, and the community is really what's brought us through this. So my story, you know, quickly is that our first two children were born without any mitochondrial issues, and when we were on our third, we were blessed with twins, and after they were born in 2005, in December of 2005, we started to notice that our son Matthew wasn't thriving in the way that his twin sister Gabrielle was, and over a period of, you know, about 12 months of diagnosis, as you know, again, many of you have endured probably even more lengthy, you know, periods of trying to understand what underlying condition your loved one has. We learned that Matthew had pyruvate dehydrogenase deficiency, mitochondrial disease, that prohibited his ability to, you know, create pyruvate, which of course, you know, prohibited his ability, or at least lessened his ability to make glucose. Devastating news, of course, and we, as you know, any parent or caretaker would do, again, like many of the people on the call, we were searching for answers beyond Children's Hospital and the specialists that we had involved, and you know, I landed on this, you know, little website, you know, MitoAction, and popped the call into the, you know, I don't think it was called Mito 411 at that point, but whatever the helpline was in 2006, and lo and behold, got on the phone with somebody who actually knew a little bit about what I was talking about, and it just meant so much to me that it you know, it really changed our perspective, which at that point was desperation and loneliness, to having a little bit of hope. And so, fast forward, we joined, being involved in one of the, original walks, eventually tried to use our connections to, get donors. We built a big team, at the walk. You've seen probably our team, the Matadors, in recent years. But I was invited to the board probably in 2007, and have been serving ever since. So Matthew unfortunately passed away in 2013. He was on the ketogenic diet, which was really the only known therapy for what his particular condition was. He was on the Mito cocktail. I mean, you guys know all this stuff of the lipoic acid and the carnitine and the bicarbonate, and all these kinds of things, as well as the keto diet. And he had an unbelievable personality. And while he was severely limited in his abilities, the one thing that he didn't have any lack of ability to do was to connect with people. And even as a little guy who just made it just past his 8th birthday, he had an amazing amount of connection with people. Anybody that he met, he had an influence on. And so thankfully we've been able to just channel that energy that Matthew had, ironically, into MitoAction. And so our family's passion to continue to help the families of those who are seeking a community, are seeking support, are seeking education, our family's commitment to continuing to try and drive all the different programs that we'll review here in a minute, has never been more strong. As we continue to grow this thing, we continue to get more and more motivated, and we continue to see Matthew in everything that we do. So I just wanted to start with, I'm surprised I actually got through that without choking up. I guess it's practice. But I just wanted to start with, again, a real message of commitment. What we do at MitoAction is special, and it's meaningful, and we are not going to stop. The programs that we're running with support and awareness, and we're going to grow those, and we're going to continue to grow with grants and funding, larger corporate sponsors, so that we can help this community and navigate our way through to a cure. So again, thank you all of you for joining, and thank you for your volunteerism in participating in this community. So MitoAction continues to be here for the families, to support them as they navigate this devastating disease. We are absolutely honored for the trust of the community and the partners who have joined us to help support these families. And I'd like to just start with a little bit of the highlights of 2019. First on the list is, to date, more than 375 children with mitochondrial disease have attended the summer camp. The summer camp, maybe you don't know the story, you probably do, but we were doing that before Matthew passed away, and that was one of the things that we were really looking forward to Matthew to participate in, but you needed to be 8, and so we lost Matthew 8 days after his 8th birthday, and 6 days before Christmas, and he was never able to attend those camps, and that's part of the reason, at least my family is, and our network has been so driven to make sure that we keep driving the summer camp, the effort. In 2019, we also awarded 13 Camper Fund scholarships that have allowed students with Mito to attend universities like Boston University, University of Michigan, University of Florida, and that was really all Kyra. When we started the scholarship idea, it was meant to be a little bit more local around our community and our high school, and it was MitoAction's board and Kyra that came up with the idea. There's plenty of people out there that have mitochondrial disease who who are still very able and are going to live long, lives here, who are going to college. Let's help some of those kids that are well enough to go to college to release some of that burden. So we're just, continuing to love everything that we do about that. We serve over 1,200 patients, family members, and caregivers through the Mito 411 support line. Our newly launched MitoAction mobile app is helping families manage their day-to-day with mitochondrial disease while providing very valuable data about the journey with Mito for researchers and clinicians. Many of you, I'm sure, have seen our new website, thank goodness. We've had over 350,000 unique visitors hit the website since we launched, which, if we could do, I should have figured out how we could have wired in applause to the special effects here to the call, but 350,000 unique visitors is amazing. We continue to award Marcel's Way Family Fund grants that provide financial support to families. The Nice for Bryce Kindness Project has touched, numbers of families struggling with the extended hospital visits or the loss of a loved one over 100 times. It's just an unbelievable program that we're running now, thanks to Jamie. This holiday season, we gifted 66 children with Mito Santa's holiday surprise to ensure that regardless of the financial strain of the disease, the children didn't go without something during the holidays. We expanded our team with additional support staff to help serve the growing numbers of families who reached out to MitoAction every day. And we're now supporting the International Mito Patients Association patient support efforts by fielding support calls on a global scale. So, needless to say, our tiny little team has been very busy and has made significant contribution to the mitochondrial community. In 2020, thinking forward here, we are going to launch a new partnership with Give Kids the World, and that's going to expand the Camper Fund to allow families to fulfill their wish of going to Disney World. And we're going to send our first families in the fall of 2020. I am just super thrilled about that partnership. We will continue to expand our Mito socials and patient education forums across the country that connect families in their local communities and bring Mito experts to areas that don't readily have access. We're going to have a new version of the MitoAction mobile app. It's already new. We're going to even get a better one to help give you even more control of your medical journey with new added features. And many of you have given some great feedback on what you do and what you don't like about the app. So, new version is coming. We're welcoming the fatty oxidation disorder community as we host a patient conference in July, along with the Organic Acidemia Association. We'll be supporting the growth of the Mitochondrial Disease Care Network to ensure better quality of care for the Mito community, along with the MMS and the UMDF. Our MitoAction Board of Directors continues to be committed to expanding our program offerings so that we can continue to support families in unique and personal ways. So, there's a lot in the pipeline. There is so much that we can do, and our motivation and our energy towards that is unbounded. So I guess I'll end with just a note that we really encourage you to reach out to us, to let us know how we can support your families and stay connected through social media, the website, the weekly support calls, joining us for the live events across the country. Whatever way that you can participate and reach out, we highly encourage the connection and the feedback. We are naturally always, looking for more sponsors. I can't do this call without, mentioning that, we've always had, an energy to try and I apologize for the sirens. I'm in the middle of Boston. But we have always tried to get more and more corporate sponsors to try and fund this thing. We know that the Mito community of those that are affected has been very generous in their donations, but we also know that that community really struggles, and we'd really like to reduce that burden by getting bigger companies to join this cause. So by all means, if there are people that anyone knows that, maybe work for, generous and philanthropic companies or know philanthropic people, we'd love to be introduced to, give them an opportunity to understand the impact that we make and see if we can, continue to drive that, those generous donations so that we can continue to provide for our community. So again, thank you for everyone that has joined the call, and thank you for all of you that support the mitochondrial disease community, and maybe hopefully over these events this year we can meet. So thank you, and God bless.
Thanks so much, Paul. I appreciate it. And as everyone will notice, if you're on the Zoom meeting, you see some faces along the bottom of the screen, and I wanted to make sure, because we are all over the place, and we don't always get a chance to see everybody in person, that everyone got a chance to see in person our incredible MitoAction staff. So I'll have each of them just share a little bit, just very briefly, and before we get into all the other organizations. So kicking off our team will be Jeannie Freeman, who is our Director of Finance and Operations.
Thanks, Kyra. Hi, everybody. I first want to say just a thank you to everybody for taking the time to, share your Friday afternoon with us, and for all of your contributions to the Mito community. So I wanted to talk a little bit today about the events that MitoAction has planned for 2020. So keeping in mind all of our events power our programs and resources, and this year we're excited to add a few new events to our calendar. So the Genes for Genes event takes place on World Rare Disease Day, which is the last day of February, the 29th this year, which is kind of cool. This day encourages schools, corporate offices, and local businesses to donate $5 to Rare Genes throughout the day and start a conversation about mitochondrial disease. In March, a local family in Marshfield, Massachusetts will host a Smash Brothers video game tournament in honor of their 13-year-old son. MitoAction will host the 7th annual Matthew Hardy Mito Classic at the Youth Center in North Andover, Massachusetts in April. This is a day where middle school kids, high school kids, and even some teachers come together to play street hockey and raise awareness about Mito in honor of Matthew Hardy, who Paul spoke about earlier. Also in April, MitoAction will partner with a nonprofit formed by a student at Babson College called Graceful Gears, which will give kids with Mito the chance to ride in specialty cars of their choice. Their fleet includes exotic, supercars, sports cars, luxury, and classic cars. The 11th Sandra K. Russell Derby Day benefit for Mito will return in May to Royale in Boston. This is a Kentucky Derby themed event full of excitement, auctions, contests, and of course, the most exciting 2 minutes in sports. In June, we will light up the sky at our Light the Sky celebration, created to celebrate the life of Bryce DeRozier, who lost his battle to Mito at just 16 months old. All proceeds of that event will fund our Nice for Bryce Kindness Project. In July, we will partner with the Organic Acidemia Association to co-host the 2020 International Metabolic Conference in Pittsburgh for families with organic acidemia and fatty acid oxidation disorders. In August, Team MitoAction will participate again in the Falmouth Road Race. In September, we will kick off Mitochondrial Disease Awareness Week in Boston with the 16th Annual Energy Walk and 5K. And then a week later, we will end Awareness Week in Syracuse, New York with the Payne family. They'll host the 2nd annual Energy Walk there to honor their 8-year-old daughter, Caroline, who has Mito. And then also in September will be our Birdies for Bryce golf outing in Massachusetts. Then we move to October, where we will host the 7th Matthew Hardy Golf Tournament in North Andover, the 5th annual Capes for Cal 5K in Seattle, and the 2nd annual Satellite Energy Walk in Rochester, New York, with the Myers family who lost both their dad and their uncle to mitochondrial disease. So to learn more about any of these events, you can visit our website at www.mitoaction.org/events. I also real quick wanted to mention the Matthew Hardy Scholarship. Paul spoke a little bit about that as well. Started in 2015. Our applications are open for this upcoming school year, and the next deadline is May 31st, 2020. So if you have a high school senior or currently enrolled college student, you should think about applying for the scholarship. You can visit mitoaction.org/scholarship to learn more.
Thank you, Jeannie. Appreciate it. So next up, we will have Jamie DeRozier, who's the Director of Patient and Family Support.
Hi, everyone. So I'm going to speak about a few programs that Paul kind of touched on, and I'll go briefly into them, and so we don't have to really go into them real in depth since he kind of touched them all on them already. So as Kyra mentioned, I am the Director of Family and Patient Outreach. And my family is touched by Mito. I have 2 children with mitochondrial disease. One, my daughter that I love in life. My son is Bryce, that was mentioned in a couple of the programs that I love from above. My journey has led me for my passion to help with patients and for support and advocacy. I'm going to just talk for a few about the programs that we have with MitoAction. And we have a lot of that started with patient support through social media outlets. And so I really do support people reaching out through us through our social media, because we get a lot of people that have come through our MitoAction group that we lend out through other groups that are on there, like our MitoAction Memories that is on there that you might not know that you have for our loved ones that may have our Mito Angels. So that's one of our MitoAction Memories, where we go on and we can support each other through community connection of ways of just support through our grief and our love and support on that group. So that's one of our programs that we have online. And then one of the other programs that we have through social media is sorry, I'm going through these real quick, sorry. I was trying to go quicker, is our new MitoAction Momvakits, which is one of our other new programs that has just been launched. So it is a program of moms where we uplift each other, empower and support each other, and we meet monthly virtually. This group was created because we found that through the connection of the commonality of having walking the same day to day, we're able to speak to each other in a way that we just all get it. So this group is something that we all can share what's working for us and share in a group in a private space that's safe. And if that's something you're interested in, please reach out to us onto the webpage and send an email to us and let us know that you're interested. The next one would be the Mito Santas. And that is a program that was created by Jennifer from Buffalo, New York. And that is something that Paul had mentioned, that we are able to send out gifts to families and homes for them to have a gift around Christmas. We know that it gets a little bit financially tight around the holidays, especially with co-payments. And, you know, that is just one of those areas that we are so happy that we're able to help support and give that back to the community. So we were able to give out 66 gifts this year. The next program I really want to talk about is building programs into your communities. So that would be one like our Mito Socials, where you're able to, or help you find a venue in your area, walk you through step by step from invitations, flyers, and then closing out your event to ensure that you enjoy making those connections with your friends and that we're there with you every step of the way. So it's really just an easy, simple process. And that way you, all you enjoy is just being there and enjoying the event. And then we just have a step-by-step process, easy, and we make it as simple as possible for you. So that's something that we can set up for you very simply through our website. And speaking of just simple processes, another new program we have set up is our Positive Peach with Genevieve. That was created because she wanted to have a positive impression on one person, and she was shown that that can change a life and make a positive impact. So she created this program, and that is where she sends out these positive packages to people just to uplift their spirit as they go through this journey. And similar to what was created by myself, in honor of my son Bryce, we created Nice for Bryce as a kindness project to send to families that are on extended stays in the hospital, like we were with our son for 4 months. We created this project because we were really shown the true human spirit of people, and it really did get us through those dark moments and uplifted us in moments that we were really falling. So we chose to start Nice for Bryce to send care packages and kindness packages to really show these people they aren't alone on a journey. And it's not just the kindness packages, it's support through messages and letters and calls and texts, and just really being there for that person and continuously showing up. So once you're in the Nice for Bryce Kindness Project, you're not alone, and we support you completely as a team. So it's been really nice to partner with MitoAction and be a part of this team. And it's been how I started with them was through a Facebook message. So it's kind of become full circle. So really, if you are looking for support, reach out to us through a Facebook message, and we are here all the time. So thank you guys so much. And I'm happy to hear from you guys in the future.
Thanks, Jamie, appreciate it. And last, our newest team member is Stephanie Tomlinson, who'll just talk really quickly about our Mito 411 support program.
Hi, everyone. As Kyra said, I'm brand new to the team. I have been working with them on the 411 support program. And as Paul mentioned, that was sort of how I became affiliated with MitoAction back in 2007. I was given a pamphlet about MitoAction at our visit at the physician's office, and I was able to connect with someone to help put together some IEP suggestions for my son. And it was phenomenal for me to learn that there were other people, as Paul said, that understood what we were going through and who had an understanding. And so I'm really grateful to have this opportunity to be that resource for people who call in, whether they're just looking for an understanding ear or some significant pathways into this unknown disease world. I'm here to help. And please, if you know of anybody, or if you can have a reason to call, don't hesitate. We're here to support you and give you all the knowledge that we have collected over 20 years.
Thank you, Stephanie. I appreciate it. Okay, that was a lot. So you can see we've been really busy at MitoAction, working hard every day to continue to give our programs, to grow our programs, and to continue to serve the community. And we would encourage you to continue to reach out and let us be there for you. So let's get started. Our first speaker is Dr. Fran Kendall with VMP Genetics. Dr. Kendall, are you here with us?
Yes, I am. Thank you, Kyra, and Happy New Year, everyone. I will keep it brief as well and to the point. So many of you in the community are familiar with our group. Just very briefly, however, I'll just summarize kind of the basics of what we do and where we're going this current year. So we have several arms in VMP Genetics. We have our direct patient care division, in which we diagnose, manage patients with mitochondrial and other metabolic diseases. We also have educational and hospital services arms to our group. So in regards to the educational component, we do regional conferences trying to promote education and understanding of mitochondrial and other metabolic diseases. This year, one of our big initiatives is going to be a all-day mitochondrial disease conference sponsored by a grant. We will relay details once things are hammered out in a little bit more detail. It initially was going to be this spring, but we're going to wait until the fall, and it will be an all-day symposium. It is available to folks, but we will also be recording the event, and then we'll be providing it to both UMDF and MitoAction for their use and educational purposes. So again, that's our big educational initiative. We're also looking to develop some other alternative educational online platforms. And we also have a grant from the Fatty Acid Oxidation Foundation to do so for those specific diseases. the last thing that I'm going to talk about, and there's a big emphasis this year, is our hospital services and support to programs all around the country. So as most of you are aware, there are a few mitochondrial experts, few practitioners who understand these diseases. And not only that, there's very few biochemical geneticists and people who understand metabolic disease at large. There's data that suggests there's, out of all the geneticists, and we're about 90 to 100,000 short in the community, we have only 10% of them are metabolic specialists. So many programs are underserved, understaffed, and stressed. And we've developed a hospital service system whereby we provide support to those programs through our physician staff. So we have currently 2 physicians who provide support to programs in California, in Texas, Oklahoma, Vermont, and other places in the Midwest and East Coast. And so one program director stated that with our support, we were able to save her program. So this was a big children's hospital program that without that support would have gone under and left deficits to the metabolic and mitochondrial community in that area. So it's certainly, if you are in a situation whereby you serve on a board in a hospital, or you have some input and impact into those type of issues in areas that are underserved, you can certainly contact us or have someone contact us about these type of services if you think it would be helpful in your community. So again, we're very proud of our outreach programs that have helped support and provide care to hundreds of patients who would have not received the care they had we not been available to do that. And as I indicated, that's a big focus of our expansion this year. We are looking to continue to support other programs around the country, and we're very excited about that. So that's a brief summation of our programs and our directives for the year. Again, we do both direct patient care in our office here in Georgia and Atlanta, but we also have all these other programs that we are developing and expanding, and that's going to be our biggest focus for 2020.
Wonderful. Thank you so much, Dr. Kendall. And we look forward to learning more about the conference and sharing that information with the community.
Okay. Great. We will do that as soon as it's all solidified, Kyra. And thank you again, everyone, for your for the opportunity to update you on what we've been doing. And again, best wishes for the new year.
You too. Thank you so much.
You're welcome. Bye-bye.
Bye-bye. Next up, we have Dr. Matthew Klein, Global Head of Gene and Mitochondrial Therapies for PTC Therapeutics, formerly BioElectron. Dr. Klein, are you with us?
I don't know that.
All right, he must be held up. So we'll move on to the next presenter. So next up, we'll have Dr. Amel Kara, who is president of the Mitochondrial Medicine Society. Dr. Kara? Okay, she must be held up as well. All right, let's keep going. Next up, Brian Harmon, CEO of the United Mitochondrial Disease Foundation.
Hi, Kyra, I'm here.
Hi, Brian, thank you.
Thank you so much for the time and the opportunity to share this afternoon. So Brian Harmon from UMDF. I'm going to kick off and talk a little bit about what UMDF has planned from a research and scientific discovery standpoint for 2020. Once again, we'll be dedicating over $1 million into our scientific and investment portfolio for this year, and really centered on our classic research prizes, 2 research prizes for one for an early stage investigator and one for an experienced investigator. That grant cycle is opening up here in the next few weeks. Those will be $100,000 prizes, along with a $50,000 prize for our postdoctoral fellow prize through our accelerator program, which I hope you all have had the chance to see this past year, which gives our donor community an opportunity to vote on the research that they think should win that prize after being vetted by our scientific and medical advisory board. We have a new program this year. Over $100,000 will be unleashed for strategic opportunity grants. This gives an opportunity for our friends in industry who are looking at moving programs along, who are looking for some funding, and some other kind of non-traditional ways that are outside of our grant program as an opportunity to fund some projects. On top of our $1 million commitment into our scientific investment portfolio, we are well underway in our Leigh Syndrome International Roadmap Project. This is an international collaboration with the Mito Foundation, Lilly, MitoCon, and PALS. Over $1 million has been raised for the project thus far. This is in addition to our portfolio projects I mentioned earlier. We have a data sharing project that is already underway with the collaborative, and we'll have our first grants for the Leigh Syndrome Roadmap Project announced here real soon. We just closed that grant cycle down. They're under final review, and we'll be sharing that with the community here soon. We're very excited to start to put some of these dollars to work. Of course, we always have grants that we fund through the generosity of our patient family impact funds. Many patient families, as a way to support our organization, create their own family funds through UMDF, and we work with them specifically to align their interests with research projects happening around the globe. Outside of the grant program, we continue to invest in developing and sustaining infrastructure through our investments in our genomic data investment through the MSeq-DR project. We continue to wrap around support for clinical data investment through the North American Mitochondrial Disease Consortium, which we are pleased to announce received another 5-year grant renewal. We will continue to support this program financially and through the Coalition of Patient Advocacy Groups at the NIH. We continue to invest in patient data, and through our Mitochondrial Disease Community Registry, where we collect patient input data. We have a paper right now that is submitted for peer review of an analysis of the data we have collected there. So we'll be anxious to share that information with all of you this year as well too. Of course, as discussed earlier, UMDF along with MitoAction is proud to support the good work of the Mitochondrial Care Network, and Dr. Kara, when she's on, we'll share more about that. But our continued investment in patient care is of utmost priority for us as well. On an advocacy and regulatory standpoint, we are down on Capitol Hill, consistently beating a drum for our patient community in Washington, D.C. and in district across the United States. We're focused right now on the Medical Nutrition Equity Act to provide access to medical foods. We're active on a couple bills right now surrounding access to genetic testing. We continue to recruit for our Mitochondrial Disease Congressional Caucus. We have 31 caucus members right now who are dedicated to understanding and advocating for issues for mitochondrial disease patients and families. We've to date have over $140 million in follow-on funding through the federal government from investments that the UMDF has made throughout its 25 years. Exciting news for our community, and in partnership with MitoAction and the Muscular Dystrophy Association, we published the Voice of the Patient report, which is the report that came out of our externally led patient-focused drug development meeting held last spring. So I encourage you all to visit umdf.org or fda.gov to see the Voice of the Patient report, which really highlights the burden of the disease for our patient families. From a patient family services standpoint, education and support-wise, of course, it's a year-round effort, but we're gearing up for our annual symposium, where we bring together over 700 clinicians, researchers, and patient families from around the globe for a 1-week blitz on mitochondrial disease research, education, advocacy, and support. This year's event will be held June 24th through the 27th at the Desert Ridge Marriott in Phoenix, Arizona. We're also focusing on bringing Mito closer to your home through expanding our community education efforts. We're kicking off with a collaboration with Miracles for Mito with an event in Denver. You'll find us in Austin, Atlanta, and a handful of other markets throughout this year. And then to expand that effort even further, our organization is committing to developing a new and improved website to better serve the community. This will include a new educational hub where patient families and clinicians can come for a one-stop shop of education with video content, self-guided tours, curriculum opportunities as well too. This will roll out with this new website. Over 83 ambassadors are currently deployed across the United States at the ready to connect with patient families on their own Mito journey. Our ambassadors provide support both online, through our social media support groups, and of course in person. And as mentioned earlier, of course, we can't do all of this without generous support from our donors and partners. And we're grateful to many of you on the phone today who are part of that group for us. We just wrapped up our annual Give Energy holiday campaign. We, of course, are always grateful for the good support of our corporate sponsors and the grassroots effort of our community who commit to third-party special events, establish family funds in our organization, and support us through our signature event, the Energy for Life, which you can find in markets across the United States and actually across the globe. We have one in Japan as well too. But visit umdf.org to learn more about all these opportunities. And we're here to continue to connect with all of you. Thanks so much again for the time, Kyra.
Thanks, Brian. I appreciate it. And, just excited to continue to build our partnership with UMDF and continue to serve the patient community. So thank you for giving us your time today.
Likewise, thank you.
Yeah, we're going to go back to Dr. Amel Kara, who is president of the Mitochondrial Medicine Society. Dr. Kara, are you with us?
Yes, I am.
Wonderful.
Hi, everyone, and thank you, Kyra and MitoAction, for organizing today's conference call. As Kyra mentioned, I'm the current president of the Mitochondrial Medicine Society, and for those of you who don't know what that is, it is a physician association that was founded in 1998 and represent an international group of physicians, researchers, and clinicians working towards advancing education, research, and global collaboration in clinical mitochondrial medicine. So we do several things, and we try to make sure that we have updated guidelines about how to practice mitochondrial medicine, how to manage patients. And in the last year, we have published 4 new papers that are accessible to our international members and to all physicians to try to raise more awareness about mitochondrial disease and how to diagnose it and manage it. In the next year, we are hoping to continue to publish these manuscripts and to come up with ideas that will serve the patients well. And as a patient community, if any of you has any ideas or any topics that you would like the Mitochondrial Medicine Society physicians to tackle that would help you in your day-to-day life or your medical management, or if you are facing medical issues locally at your hospitals and you would like the MMS to step in to try to put out some guidelines that would help you and help your physicians locally, please do not hesitate to reach out to us and give us your idea. We are happy to work with you and develop something together. We have also worked this past year internationally at developing a new guideline for safety of drug use in patients with mitochondrial diseases. This paper was just published, and this next year we are going to start working already on an updated version, because we understand that the choices of the drugs that patients with mitochondrial disease take is very important to our patients and their families, and that many drugs are coming on the market, getting off the market, and new side effects are being reported. So we are striving to keep updating this list on a yearly basis. Our biggest task that we undertook 3 years ago in collaboration with the UMDF and MitoAction was to create the Mitochondrial Care Network. We are proud to show that we so far have 18 sites across the U.S. That are certified to be almost centers of expertise in mitochondrial medicine. And so we have been very busy this year trying to finalize the administrative part of this network, finalize funding, maybe hire a program coordinator, and in the next year we are working diligently with MitoAction and the UMDF to trying to make this sustainable and to open it up to more sites across the U.S., as we understand that there is a huge gap in care within the middle of the country and in many places within the U.S. As part of that network, we did develop a new guide for newly diagnosed patients, which is available on our website, and it's really accessible. The website is mitonetwork.org, so you're all welcome to go check it out and download it. It's a PDF in PDF format. And then finally, this year, we are going to try to focus on developing other innovative ways to allow access to mitochondrial experts for our patient community by hopefully using telemedicine and telehealth to bring the experts wherever you are instead of you having to travel to see these experts. Part of our effort is also to bring awareness and educate physicians and medical health professionals about mitochondrial medicine. We have been present on 3 different continents this past year, and we will continue our presence at conferences and talking about mitochondrial disease, introducing the Mitochondrial Medicine Society, and gaining more membership and more traction. We are also collaborating with our colleagues in Canada very closely, in Australia and in Europe. And then finally, as you heard from Brian earlier, we are collaborating with the UMDF to try to develop a clinician education portal and a patient and family education portal that will be housed on the UMDF website. We are also happy to report that as part of the mitochondrial medicine and collaboration with the UMDF, we now have our own dedicated session at the UMDF symposium, which is held yearly, and that is in an effort to attract more clinicians to attend the meeting and learn more about mitochondrial medicine. And I think with that, I will stop. And I'm happy to take any questions at the end, or if you would like to email me, you can do that through Kyra and MitoAction. Thank you, everyone.
Wonderful. Thank you, Amel. And just to, you can also reach the MMS on their website at www.mitosoc.org. And there is a contact link where you can submit questions and information directly to them as well. Or you're more than welcome to email MitoAction and we will connect you with them as well. So thank you so much, Dr. Chiara. I appreciate it.
Thank you.
So we're going to also go back to our next speaker, Dr. Matt Klein from PTC Therapeutics, formerly BioElectron. Dr. Klein, are you there?
I am, Kyra. Thank you very much, and I apologize for my earlier technical difficulties. Happy New Year to you and to everyone else on the line. As many of you are likely aware, BioElectron's assets, that includes our drug EPI 743 and other compounds, were acquired late last year by PTC Therapeutics. This is a very exciting development for the mitochondrial disease community for a number of reasons. For those of you who aren't familiar with PTC, PTC is a rare disease-focused biopharmaceutical company that has headquarters in New Jersey, but with offices worldwide. The company has a long-standing commitment and incredible expertise in rare disease drug discovery, development, and global commercialization. This is a company that from its start has been focused on developing drugs for rare diseases, and with the addition of EPI 743 and the other BioElectron compounds, there'll now be a focus on developing drugs for mitochondrial disease. So this is very, very exciting. With PTC now helping in the development of EPI 743, this will bring increased resources, increased experience, and really increased muscle behind the development of EPI 743, as well as some of the other BioElectron preclinical compounds that could be developed for mitochondrial disease. So again, a very, very exciting update. Now for 2020, we plan to start by launching a worldwide clinical trial to study 743 in children who have mitochondrial disease and associated seizures. And we expect this trial to start later in the first half of 2020. We will look forward to sharing the details of this trial, including study sites, locations. I will say that the study sites will be located worldwide. That's both within the United States and outside of the United States. We'll also provide additional information on inclusion criteria and other key information about the trial with the community in the coming weeks as it becomes available. In addition, we're going to continue to explore other potential trials to continue to advance 743, as well as a number of our other compounds to children and adults affected by mitochondrial disease. I do want to point out a couple of significant milestones that were achieved in 2019 for API 743. 2019 marked the 10th anniversary of the compound being in the clinic. The first patient was dosed with API 743 in 2009, and as well, 2019 marked the 10th year anniversary of continuous dosing in our longest treated patients. This is a boy with Lee syndrome who has been on drug and remains on drug now for over 10 years, which is a very, very exciting milestone for us. So looking forward, again, we expect this to be an exciting year. We're looking forward to the continued development of 743 for people with mitochondrial disease. We look forward to bringing additional therapies into the clinic that can address all different types of mitochondrial disease in all different patients. As I said, we'll continue to work with Kyra and MitoAction to keep the community well informed about the mitochondrial seizure trial that we'll be launching later in the first half of this year, as well as any other important updates. So thank you again, Kyra, for the opportunity to share our exciting updates with the community.
Thank you, Dr. Klein. I appreciate your time, and we look forward to sharing that information with the community. Okay, up next, we have Rena McCarthy, CEO of Stealth Biotherapeutics. Rena, are you there?
Can you hear me?
Yep, I can hear you.
Sorry about that. So I'm here with Jim, our Chief Clinical Development Officer, and I thank you, Kira, and your team for giving us the opportunity to join today. Last month, we announced very disappointing results from our MMPower Phase 3 clinical trial, which unfortunately did not meet its primary endpoints of improvement in 6-minute walk test and primary mitochondrial myopathy symptom assessment total fatigue score. This was an unanticipated and extremely disappointing result following encouraging data from our Phase 1/2 and Phase 2 clinical trials in this indication. Although there was improvement observed in the primary endpoints in elimipritide-treated subjects, there was also improvement observed in patients assigned to placebo. I want to extend our sincerest gratitude to all those who participated in the trial. Over the years, our company has developed a close relationship with the mitochondrial disease community, including patients, caregivers, clinicians, and patient advocacy groups, including MitoAction. Through these interactions, we've come to see the immense burden the disease presents. We are keenly aware that these disappointing results will be a setback for the mitochondrial disease community, which has an urgent and imminent need for effective treatment. Jim will spend a few minutes sharing some thoughts on our Phase 3 data, and I'll conclude by speaking to why we remain confident in the promise of elimipritide and our mitochondrial medicine platform. Jim?
Thanks, Rini, and good afternoon, everyone. I'd like to first join Rini in thanking all the patients, caregivers, and investigators for participating in an MMPower 3 study, and our employees who worked tirelessly to complete this study and generate a high-quality data readout. As a reminder, MMPower 3 enrolled 218 subjects with primary mitochondrial myopathy between the ages of 16 and 80 to evaluate the efficacy and safety of elimipritide over 6 months. Patients who completed the double-blind portion of the study were eligible to continue into an open-label extension. Although we designed this trial incorporating learnings from our Phase 1/2 study and Phase 2 trials and intended to minimize variability and enrich for 6-minute walk test performance, we believe we were handicapped in this indication by a lack of non-subjective endpoints. Both the 6-minute walk test and the measurement of fatigue depend on patients' effort. In the first instance, the subjective perspective in the second. Although we adopted conservative powering assumptions and enriched inclusion criteria to ameliorate the changes that may be presented by such effort based on subjective endpoints, these safeguards proved insufficient to address the power of hope. We observed a placebo effect distinctive from our Phase 2 precedent and rivaling drug effect, which is our best immediate explanation for the results that were observed. As mentioned, we will review the complete data set as it reads out, but at this point in time cannot comment on any future plans for the development of elimipritide in primary mitochondrial myopathy. From a regulatory perspective, this disappointing data also means that we can no longer maintain our SPIM 203 and SPIM 301 Part 2 open-label extension protocols for patients with primary mitochondrial myopathy. For patients participating in these protocols, your clinical trial sites have been notified and will likely be contacting you shortly regarding next steps. As a patient-focused company, this has been a very difficult decision for us. We plan to discuss this situation with regulatory bodies to determine whether there is a possibility to provide access to elamiprotide through an expanded access program. We are also continuing to evaluate the results of this trial and hope to gain more clarity around why we didn't see the desired treatment effect in the study. I'll now turn the call back over to Rini.
Thanks, Jim. So reiterating Jim's disappointment and the difficulty of this decision, I do want to reiterate our confidence in our ongoing clinical programs with elamiprotide. Those include Barth syndrome, which is a genetic mitochondrial disease, and geographic atrophy associated with dry age-related macular degeneration, the leading cause of blindness in the elderly, as well as a very robust pipeline. In Barth and dry AMD, unlike primary mitochondrial myopathy, we've identified non-subjective endpoints measuring disease progression. I'll speak very briefly to Barth because it is also a genetically inherited mitochondrial disease, so of interest to this community. In that program, we have 2D and 3D echocardiographic imaging, which allows us to look at changes in parameters of heart function, the leading cause of early mortality in Barth, as well as in a number of other mitochondrial diseases. These data suggest an improvement in cardiac function in 11 out of the 12 total participants in the trial, which resulted in a statistically significant increase in cardiac stroke volume in the cohort of 8 patients still enrolled at week 36 of open label extension. So we were seeing significant changes in open label extension. These improvements in heart function were correlated with improvements in other endpoints, including a 95-meter improvement from baseline 6-minute walk test distance observed at week 36 of open label extension and significant improvement in strength. These suggest a reversal of disease-mediated cardiac remodeling, which we believe is encouraging for this patient population, and we're seeing evidence of sustained improvement out to week 96 of open label extension and plan to meet with FDA later this year to discuss our regulatory path forward. We have a number of pipeline compounds we've optimized and differentiated based on our understanding of mitochondrial science, and we'll be initiating a phase 1 study with lead pipeline candidate SBT272, for which we have promising preclinical data in a model of ALS. Ultimately, we remain deeply committed to developing medicines for those suffering from mitochondrial disorders, and we are very confident in the potential of our product candidates to provide meaningful therapy to patients. Thanks again for your time today. We appreciate it.
Thank you so much, Rini. And as I said when I opened, I know these were not the results that we were all hoping for, but we hope that the Stealth and all of your team know how greatly we are indebted to all of the work and the commitment that your company and your team has made to this community. So we appreciate that.
Thank you.
So up next, we have Blaine Penny, who is the CEO of Mito Canada.
Hello, everyone. Can you hear me okay?
We can, yes. Thanks.
Well, hello from the Great White North. And I also just want to reiterate Kyra's comments to Rini and the Stealth team. Though disappointing, we want to thank you for your commitment and your continued commitment going forward. You're getting close, so don't give up. And we're very appreciative from the patient community for your support and your foresight and vision for future therapies. So taking a look back at 2019, we kicked off last year, starting with some planning. We developed a new 5-year strategic plan. We developed our first ever fund development plan. One of the things, Mito Canada is still a fairly small grassroots organization with between part-time people, we're about 2 full-time equivalents. So we're really trying to focus on our ability to scale our resources and impact, and that requires fundraising. So that's been a big focus for us in trying to be strategic in how we approach that. One of the areas that we really focused on over the last year was updating our website with new content, and in particular were education and support materials. Those included an update of all the support resources that are available in each of the provinces across Canada, and that's all available on our website, as well as adding a list of all the metabolic clinics that many of our patient community reach out to us to get referrals to see specialists, which there are few and far between across the country here. We were successful in working together with our MitoNet community and University of Toronto in getting the Connaught Innovation Award, as well as a CIHR grant, which helped fund our annual conference, as well as other MitoNet initiatives that will continue into 2020 and 2021. We hosted our Toronto conference. It was our second conference that we've hosted. We had over 200 delegates, including over 50 patients and family members, represented 6 provinces across Canada, as well as 5 countries. We had an excellent lineup of speakers and tremendous feedback from those that attended. And we'll be continuing with an annual conference from here on as our plan, and next year we'll be in Ottawa. We established the first ever mitochondrial disease research chair at U of T, and that was been awarded to Dr. Anna Andriazza. She's doing phenomenal work, and she leads our mitochondrial network, MitoNet, and she's doing great work in rallying our research and entire community. One of the last things I want to mention in looking back in 2019 is we worked together with the Canadian Stem Cell Network and the McGill University Center for Genomics and Policy, and developed our position statement on mitochondrial replacement therapy. So it's great to have that completed and showing our support of continued research, which is currently illegal in Canada. So that's posted on our website. So as we look ahead to 2020, a lot of it will focus around our fall conference in Ottawa and an advocacy strategy around that. We have a great opportunity by being in the nation's capital to meet with politicians on Parliament Hill and raise the profile of mitochondrial disease and its impact and burden on the Canadian society, given the challenges this community faces. You know, and one of those topics that we want to tackle is the mito cocktail and that financial burden that is placed upon many of the families across the country. Currently, the only province that has a provincial mandate for covering metabolic disease supplements is in Ontario. So they've got a great model if we could replicate that across the country. So this is an area that we'll be looking to really partner with our patient community. And there's several families that are already quite active and advocating for the cocktail coverage and been in the media. So we'll be working together to develop that strategy and hopefully get in front of politicians as part of our fall conference. And as well, we're going to be working with, continuing to working with the experts and as we develop approach around the mitochondrial replacement therapy. It's great to see the work that has been done, obviously in the UK leading the way, and now Australia is getting a lot closer on that front as well. So lots that we can learn from the others that have been successful along that path. So one of the exciting other areas from an awareness standpoint, it's MitoCanada's 10-year anniversary next year. So you know, using 10 as a theme, one of the things that we wanted to do is find unique ways that we can raise awareness about mitochondrial disease. So we're going to attempt to do 10 Guinness World Records over the course of 2020. And one of those Guinness World Records will unite our global mito community with Light Up for Mito. So the current Guinness World Record was completed in partnership for breast cancer with Estee Lauder, and they lit up 38 national landmarks around the world. So we're hoping to better that and set a new Guinness World Record and put mito on the global map. So we're also seeking a global sponsor for that. So if anybody has any ideas of organizations that could support this initiative globally, don't be shy and reach out. This is a great opportunity to partner with a global corporation. And we also look to expand our patient and family support program, adding capacity to increase our patient engagement at a one-to-one level and education and outreach services. From a research standpoint, in collaboration with MitoNet, there's a few areas that we'll be focusing on. There's another grant opportunity coming up with the New Frontiers in Research, and that'll be an extended probably 12 to 18 month process, but if successful, that could be in the many tens of millions of dollars. So it's a big effort, but a big return on that if successful. So we'll be working on that grant application. We're currently in the process with U of T working on a patient population survey, so hoping to complete that over the coming year. And through partnership with Carleton University, we'll be working on developing a new patient registry as part of MitoCode and as part of the global patient registry initiative that IMP is leading. So aside from that, there's lots of events on the slate. So I encourage people to check out our website, stay tuned on our social channels, and feel free to email us at info@mitocanada.org. If you have any questions or you have any ideas, certainly reach out. And I just want to extend a thank you to our Canadian and global Mito communities who do host awareness events and fundraising to support what we do and to help move this initiative forward. So looking forward to collaborating with everybody in 2020. And thank you for your time, and Kyra for organizing this call.
Thanks, Blaine. I appreciate you joining us today and for all the hard work that you're putting in to support this community. Next up, we have Tolga Hughes, the Senior Medical Director for Astellas Pharmaceuticals. Tolga, are you there? If you are, just you can click the unmute button. There you go. Okay, you should be good now.
Okay, thank you. Thank you, Karen. Hello, everybody. My name is Tolga Hughes. I'm a Senior Medical Director at Global Development Team here in Astellas Pharma. Astellas is a mid-sized Japanese pharmaceutical company with more than 100 years of drug development history. Astellas operates globally, develops and markets a number of compounds in various therapeutic areas, including oncology, urology, transplants. A few years ago, Astellas had a new mission, becoming the leader in developing therapeutics that treat a wide range of serious diseases by modulating mitochondrial function, which was started co-founding a biotechnology company, MitoBridge, which presented in this forum in previous years. In 2018, Astellas fully acquired MitoBridge, retaining the team and the site in Cambridge, Massachusetts. Last year, we took one more step forward to achieve this mission, identified mitochondrial research and development as one of our key primary focus areas. This move enabled us to support development of diverse pipeline and of preclinical programs, advancement of multiple programs into global clinical development, and further bringing global regulatory and marketing capabilities of big pharma into the mitochondrial research field. Currently, Astellas is developing two PPAR delta modulators. The PPAR delta target regulates the synthesis of new mitochondria and energy generation by fatty acid oxidation, and further improves muscle endurance. These drugs are the product of many years of preclinical research in our companies, working with top academic laboratories like Ron Evans from Salk Institute, who co-founded MitoBridge. The first compound is in phase 2 clinical development for the treatment of acute kidney injury following coronary artery bypass surgery. This study just recently started. The second compound, which is ASP0367, which is an oral once-a-day dosing PPAR delta modulator, which showed a good safety and tolerability profile with positive biomarkers in phase 1 in healthy volunteers. This year, we are launching two simultaneous clinical studies with this compound, targeting two myopathies in which mitochondrial functional deficits primarily and secondarily involved in disease pathology. First one is a large primary mitochondrial myopathy proof of concept study, and the second one is phase 1b study for Duchenne muscular dystrophy. We strongly believe that combining MitoBridge team's long-standing PPAR-specific research experience with Astellas' global development experience and sources, along with the help of community, including patients, families, advocacy groups, and key academic centers, will help developing efficient therapies to improve lives of patients suffering from mitochondrial diseases. You can follow our progress and learn more about our clinical studies at clinicaltrials.gov, as well as mitobridge.com. And of course, we will continue to communicate regularly with MitoAction. Thank you again for the opportunity to share our progress with the community. I appreciate it. Thank you.
Thank you, Tolga, for sharing. I appreciate it. Next up, we have Kristen Voorhees, Senior Manager of Patient Advocacy with Ultragenyx. Welcome, Kristen.
Hi, good morning and good afternoon, everybody. Thank you so much, Kyra. As Kyra mentioned, my name is Kristen Voorhees, and I work in patient advocacy at Ultragenyx Pharmaceutical. We're based in California, but operate globally. Our advocacy team is responsible for working directly with patients, families, caregivers, and patient organizations like MitoAction across a variety of different rare disease areas to really better understand patients and families' unmet needs, the challenges, experiences, and above all, what is most important to them. So Kyra, thank you again for the invitation. We're excited to share a little bit of information with MitoAction's network this morning. I'll take a minute for those who may not be familiar and just give you a little bit of information about Ultragenyx and one of the programs we're focusing on. We're a biopharmaceutical company focused on bringing to patients novel treatments for serious, rare, and ultra-rare conditions. We were founded in 2010, so I think that we're similar to Mito Canada, and we seem to be celebrating an anniversary together this coming year. One of the areas we focus on is long-chain fatty acid oxidation disorders, or LC-FAOD for short. There are several types of FAODs, and these are a group of rare, chronic, often serious, and life-threatening autosomal recessive disorders. So I'll take a minute to share a bit of background about what FAODs are in case you're not as familiar. In healthy people, the body uses glucose or sugar for energy. And once the body has used up all of the available glucose, the fatty acids are then broken down in the mitochondria so that they can be used as an energy source. In people with FAOD, the enzyme responsible for transporting and breaking down these fatty acids, it's either at a very low level or just not working properly. And without being able to use the fatty acids, the body turns to other energy sources like glucose. And this is thought to cause the signs and the symptoms of FAOD. Today, there are currently no approved drugs or treatments specifically for LC-FAOD, and some people or patients, they're managing their health by avoiding fasting, by following a low-fat diet, by using an MCT oil, or taking carnitine as prescribed by their healthcare team. We're committed to the LC-FAOD community, and we've been studying UX007, also known as triheptanoin, which is a highly purified form of a synthetic 7-carbon fatty acid triglyceride compound for the treatment of LC-FAOD. The investigational product is intended to provide patients with a medium length, odd chain fatty acids that can bypass faulty pathways and therefore provide an alternate energy source. We've completed a phase 2 open label study evaluating the safety and efficacy of UX007, and this information has been published. We are also sponsoring a phase 2 open label extension study to continue evaluating the long-term safety and efficacy of 007, and this study is ongoing. And we're also a sponsor of and a collaborator on a compassionate use study to allow patients already taking triheptanoin through previous studies access to continue their treatment. And Dr. Jerry Bockley in Pittsburgh is leading this study. You can learn more about these programs by visiting clinicaltrials.gov. In October of this past fall, we announced that the FDA has accepted for review our company's NDA, also known as a new drug application for UX007 for the treatment of LC-FAOD. The FDA has assigned us a standard review designation with a PDUFA target date of July 31st, 2020. The Prescription Drug User Fee Act date refers to the date that the FDA is expected to deliver their decision as to whether to approve or not approve a company's application. The FDA has indicated that it is not currently planning to hold an advisory committee meeting to discuss our application. One of the specific ways that our advocacy team works with the LC-FAOD community is through collaborations with fantastic organizations like MitoAction, as well as with a group of patient opinion leaders who make up our Patient Leadership Council. And we meet with these individuals impacted by LC-FAOD, both patients and caregivers, to identify areas where we can, where we have shared goals, and to really figure out what are appropriate projects or initiatives where we can support and collaborate. We established the council in 2017 and are just really thrilled to be entering into our third year together in 2020. And in fact, we've recently expanded the group to 8 members, which is also exciting. You can learn more about our advocacy team. We have a calendar of events and all kinds of education and resources on our website, ultrarareadvocacy.com. You can also check out some videos and patient stories. And again, Kyra, thank you so much. And we look forward to continued collaboration and conversations this year.
Thanks, Kristen. I appreciate it. And we look forward to sharing with the community the updates of all of your trials and everything that you guys have in the pipeline. So thank you so much. So next up, we have Dr. Jan Smitning, CEO and founder of Chondrion.
Well, good evening from Europe. I'm wishing you all a happy and healthy new year. The Chondrion team truly appreciates the opportunity to give the Mito community a quick update on Chondrion's development program and its plans for 2020. We at Chondrion are passionate to help patients suffering from mitochondrial diseases, their families and loved ones, through the development of game-changing medicines. We are passionate in help the mitochondrial disease community by leading innovation. And that's why I entered this field of medicine about 20 years ago. And for people who don't know me, I've been a professor in mitochondrial medicine for over 20 years and have been actively involved in patient care, the diagnostic process, counseling, and the research of mitochondrial disease patients. I founded Chondrion in 2012 with the ultimate goal of bringing clinically meaningful, life-changing medicines to mitochondrial disease patients. And I'm pleased to say we're making good progress. Our lead product candidate, sondicromanol, an oral small molecule also known as KH176, is being investigated in adult patients with Miller spectrum disorders. And we saw encouraging results in our phase 2A chemistry study, and these has given us the confidence to rapidly progress development. Miller spectrum disorders, as many of you will know, are one of the most frequently encountered mitochondrial diseases and are caused by a mutation in one of the transfer RNAs of the mitochondrial genome. Important clinical signs and symptoms of Miller spectrum disorders include, but are not limited to, cognitive decline, hearing loss, stroke-like episodes, diabetes, and myopathies. And at Chondrion, we are particularly focused on improving cognition. Focus on cognition is key because we believe that the brain controls the body. This affects everything we do involving thought or memory, whether that's getting ready for work, chatting with friends, or planning for the future. The impact for cognitive impairment is significant for Miller's patients. Based on the encouraging results from the Kinsey study, which showed significant improvements in both mood and alertness among our patients, we are now starting a phase 2B study at a number of sites across Europe. We expect the first patient to be enrolled within the next month, which results will be available later this year. This is something we will continue to keep the mitochondrial community updated on in 2020 through our website, our social media channels, and by continuing to work closely with important organizations like MitoAction. At Chondrion, we recognize our responsibility in continuing to increase awareness of mitochondrial disease and its impact on patients and families. This will be an important part of our work this year. In 2020, we will also start a first trial specifically in children affected by mitochondrial disease. Given mitochondrial disease can begin at any age, we want to make sure our research is relevant for all those affected. We continue to pursue ambitious goal at Chondrion, and 2020 will be a significant one in our journey to bring new medicines to patients. I look forward to keeping you updated on our progress and on the growth of the company in 2020. And with this, I would like to thank you for listening and look forward to working with you. More information about Chondrion can be found at our website, www.chondrion.com. Thank you, everyone.
Thank you, Dr. Smitting. We appreciate your time today and all of the hard work you and the team at Chondrion are investing in the mitochondrial disease community. Up next, we have John Geisler, PhD, founder and CSO of MitoCon.
Hello, can you hear me?
We can hear you. Welcome.
Perfect. Thank you very much. Thank you for inviting me. So since most of you are probably new to MitoCon, I thought it'd be good just to back up since this is our first time chatting. So we're a startup in 2014 out of Philly. My background is I have a PhD in genetics, and then my physiology work has always been in diabetes and metabolic disease physiology. So I worked for many years in drug discovery at various pharmas. And I've always been interested in one thing, which is to create disease-modifying drugs. And since I was working in the space of metabolic disease, my goal was to get people off of insulin, get off of all the drugs that they're on for insulin resistance. So I focused for many years on trying to partition fat out of the liver, out of the muscle, and to basically resolve the reasons why people the islets are working so hard. So over the years, I learned that uncoupling, mitochondrial uncouplers, and energy expenditure had this profound effect on resolving glucose flux. And then I learned that the ideas I had on diabetes actually crossed over into neurodegeneration. And since the toolbox for diabetes was excellent, but there was nothing for any of the serious insidious neurodegenerative diseases, I switched fields, left big pharma, and then went to try to make it on my own. So the uncouplers that we talk about, they're called mitochondrial uncouplers. I knew that they lowered reactive oxygen species, lowered calcium overload, and they induced a fertilizer in the brain called BDNF, which below the neck is actually a myokine for nourishing muscles and is also anti-diabetic. So most diseases are associated with high ROSes. So if you have Alzheimer's, multiple sclerosis, autism, traumatic brain injury, Duchenne's, Becker, these are all diseases associated with high reactive oxygen species. And then there's diseases that are associated with calcium overload, like Duchenne's, Becker, Friedreich's ataxia, Wolfram, Huntington's, TBI, epilepsy. And then there are diseases that are associated with lower BDNF levels. So the idea was to see whether or not low doses of a mitochondrial uncoupler could have a disease-modifying effect in serious insidious diseases. So the drug that we talk about is, its primary platform is called 2,4-dinitrophenol. This is a weak acid, and since the mitochondria is the only organelle out of all the organelles with the pH-basic environment, it's attracted specifically to the mitochondria. The target is the entire mitochondria. It modulates the entire mitochondrial physiology. So the location is actually the target. And this is a non-genomic effect. So there's no protein or RNA or receptors that it targets. It targets specifically the mitochondria to change the mitochondrial membrane potential, which cascades into this huge effect that we see. So I think for some reasons, since we're targeting the mitochondrial physiology and the mitochondria, it's not as been attractive for mitochondrial foundations per se, because we're not going after, frataxin and directly. We're going after any disease associated with mitochondrial dysfunction. And then, so for years I was trying to do MitoCon on my own, and then we wrote grants together with, I found my CEO, Robert Alonzo. But the idea was a little bit unorthodox because the drug we used was a drug that was used 88 years ago for obesity. So trying to write a grant and get support for something like ALS, which is associated with wasting syndrome, using a drug that modulates the mitochondria for weight loss just sounded wrong. And so, but even though I said 1,000 times that the dose is 100-fold lower, it never really mattered. But we were fortunate that Ben Franklin Technology Partners and a host of matching partners through Robert Alonzo, he saw everything a little bit differently and gave us the seed money in 2014. So in 2015, it was all on for proof of concept studies, new chemistry, patents, and there we learned that using the doses 100-fold lower, that DNA preserves body weight in models of wasting syndrome. It has a broad neuroprotective effect. We've now tested in about 10 different indications. Huntington's disease, Alzheimer's, epilepsy, Parkinson's, MS, optic neuritis, Duchenne's, hearing loss, traumatic brain injury, Rett syndrome, and we're in life right now for ALS, and it looks promising, all animal models. And then even though the drug's 88 years old, the patent agencies saw that it wasn't obvious that a drug that was used at, say, 300 milligrams per day for obesity could be used at 3 milligrams per day for Huntington's or Duchenne's. So we've been fortunate to get patents, including orphan status for Huntington's disease. We also have a second molecule, which is called MP201. This is a prodrug of DNP, which we call MP101, and it's a slower release, longer residency time. So, and it actually seems to have better pharmacology than DNP on its own, perhaps by this trickle-like effect it does over time. And then we've been very fortunate. Last year, the FDA granted us an open IND after finishing all the clinical study, the tox studies. So literally next month, we're going to start phase 1 in normal healthy volunteers with the goal and the hope that with success that we will start phase 2 in a series of diseases associated with high reactive oxygen species like Huntington's disease, ALS, progressive supranuclear palsy, MS. That'll be in 2002. So through this effect of DNP lowering losses, calcium, mTOR, and raising BDNF, which some people consider fertilizer of the brain, it's possible to have that. These are the reasons for this broad and protective effect. The other thing that to keep in mind is that since the target is the mitochondria, and the mitochondria is extremely well evolutionarily conserved between mouse to elephant, that since we're targeting the mitochondria as a location, translation should be excellent in terms of the conservation. So if you maybe went after an enzyme in mouse, by the time we get to humans, things could change. But it's not likely that this physiology of modulating the mitochondria and where it goes to will change. And since the effect is non-genomic, that should be conserved as well. So, you know, we're hoping to test it in diseases of mitochondria mutations like FA. We are interested in diseases like Wolfram syndrome, which is similar to ALS, but even worse if that's even possible. All the studies that we've been into so far, we've been 17 weeks in Huntington's disease model, preserved spiny neurons, general neurons, lowered reactive oxygen species, 4 months in Alzheimer's, 3 months in Duchenne's models, MS models. On all these studies, the drug has always been either preserving body weight in wasting syndromes or completely weight neutral. So we've been very fortunate in it that is, you know, that the idea that originally when that it ballooned into something that is a broad protective effect, and now it's just time to go to the clinic and see if we can hammer it out. The other thing just to keep in mind is that, so we've now been in models of neuromuscular diseases, neurodegenerative diseases, autoimmune diseases, developmental diseases, and models of trauma for brain and hearing loss, that it seems to be, as I said, this broad protective effect by modulating the entire mitochondrial physiology. We've also been in models of children, diseases of children, adult, and elderly, and we've been in models of genetic causes like Huntington's and non-genetic like MS, Alzheimer's. So it's the 2020 is a big year. This is this decade is going to be a huge decade for us to test out the ideas, and I posted a links I think too for our website and our papers if you want to learn more. Thank you very much.
Thank you so much, Dr. Geisler. You know, as we learn more and more about other diseases and their connection to mitochondrial disease, that helps to move everyone forward. So we look forward to hearing more about your research and what you're doing, and you know, being here to support your efforts in any way that we can. So we appreciate you joining us today.
Thank you.
Yes, absolutely. Next on the agenda is Amanda Baylog, who is Senior Genetic Counselor at GeneDx. Amanda, are you here with us? Okay, she must be held up. So we'll go on to the next. Next, we have Lisa Metzger, Editor, Lifeline of Lifeline Letter, Director of Community Engagement for the Olay Foundation.
Good afternoon, Kira. Thank you for having us and giving us the opportunity to share. I want to just address what the Olay Foundation is, because we are related to the Mito community, but not as directly involved as most of the speakers have been so far. The Olay Foundation enriches the lives of people living on home enteral and parenteral nutrition, IV nutrition, and or tube feeding. We provide education, advocacy, and networking opportunities to this community. And we serve as a resource for consumers, families, and clinicians, industry representatives, and other interested parties. The organization was founded in 1983 by Dr. Lynn Howard and her patient, Clarence Oley Oldenburg, that's our name. We've got, I'm sorry, my computer's beeping. We've got over 22,000 members as of last year. There's no charge for membership, and Olay programs are all free for consumers and their families. I think the biggest thing for us this coming year will be our annual conference, which will be June 21st to 23rd in Newport Beach, California. We're partnering with UCLA and Children's Hospital of LA to provide a program that offers CEs on the first day of the conference, and then a move to a more family-centered and consumer-oriented format the next day, next 2 days. There'll be a limited number of $600 travel scholarships to the families and patients for first-time conference attendees. We do a couple of awareness events each year. We do Feeding Tube Awareness Week. We participate with another organization, Feeding Tube Awareness Foundation, to do that. And we have another, it's HPN Awareness Week. The goals, of course, are to raise awareness and to help to connect people who may be feeling isolated, and to help educate that people can actually, have quality of life while on these therapies, although life isn't easy. Another big project for us in the coming year is a clinician directory, like the Mito community. People on enteral and parenteral, especially parenteral nutrition, have difficulty in finding clinicians to take care of them. So we're hoping that through the clinician directory, we can help to put specialists, to help consumers know where specialists are available. It'll include HPEN physicians, people with experience in enteral and parenteral nutrition and related fields. We have some advocacy efforts for the coming year. We're also involved with Lift Echo. Echo is an exciting program of remote learning. So we've partnered with, we are on the advisory board of the Lift Echoes Learn Intestinal Failure Echo, centered at Mount Sinai in New York City with Dr. Keisha Iyer. It's an online community of medical professionals dedicated to supporting the treatment and management of intestinal failure. So clinicians can go and present a case study, get feedback from other professionals, and then take that back to their patients. It's a way of kind of addressing the shortage of specialists. It's very exciting. It's open, it's free, and clinicians who participate also get CEs for that. And then in addition, I just want to sum up with our ongoing programs. We have a bi-monthly newsletter with medical updates on things like short bowel syndrome and Mito, and we have coping articles in there. We have regional conferences, up to 6 a year, webinars. We have an equipment supply exchange program, which would be beneficial to many members of this community. It's an opportunity to get unused supplies into the hands of people who need them. Again, there's no charge except for shipping. We have over 60 volunteer ambassadors in our program. We are a general source of enteral and parenteral information, and we also often coordinate market research projects to connect manufacturers with end users. The Medical Nutrition Equity Act was mentioned earlier. We are also involved with that and with advocating for resolution of IV drug shortages, which are a big disadvantage to our PN patients. With that, I'm going to close. I wish everyone best wishes for the new year, and thank you for this opportunity.
Thank you for sharing, Lisa. We appreciate your time today. Up next is Heather Schichtel, co-founder of Miracles for Mito.
Hi, everyone. Can you hear me?
We can.
Great. So thank you, Kyra and MitoAction, for this opportunity. I think it's always great to get everyone together and talk about the great things that we're doing. So I am the executive director of Miracles for Mito. We're based here in Denver, Colorado, and we serve the Rocky Mountain corridor from Montana all the way down to New Mexico. This NFP, this nonprofit, was started by myself and Maria Hopfgarden because there was really a gap in this Rocky Mountain region as far as research and support. Maria has had a son, Jacob, with a CARS mitochondrial deviation. I myself had 2 children with a POL G1 deviation, and my brother is impacted in his adult life with the same deviation. We are 100% volunteer-based. Maria actually can't get on this call because she has a work call during this time, but we partner very well together and are pretty excited about how we've grown as a nonprofit. Our mission has always been 100% patient support. We provide ubiquinol free of charge to our families in this area. We also provide other supplements as needed. Along with that, we provide a family grant program. So anything that families need outside of what insurance will cover, durable medical equipment, as well as respite care. We recently sponsored a date night for one of our families to go out. They hadn't had a date night together for about 10 years. So we have a very close relationship with our families and are able to provide support quickly and when needed. We do 2 support group meetings a year. Our last one was a big Christmas party. We served over 60 families in the area. A lot of families travel up to 4 hours to come and attend our support group meetings. We provide nursing care and childcare, so our adults can sit in and really pay attention to what our specialists are presenting. This year, every child and their siblings got a Christmas present. And because we are so family oriented, my stepfather was actually Santa Claus. He did a great job. This year, we continue to expand our patient coverage with weekly support calls hosted by Mary Beth Hollinger. We have a monthly lunch clinic at Children's Colorado where families who are in clinic can come, have lunch, and talk about anything that they need to talk about, mitochondrial related or not. We updated our website this last year. We're very excited about that. And as mentioned before, we are very excited to partner with the UMDF for Grand Rounds at Children's Colorado. And we will also be assisting with the UMDF symposiums since we are just north of Phoenix. Along with patient support efforts, we do provide financial support to Children's Colorado Mitochondrial Clinic. About 7 years ago, that clinic was actually in jeopardy of being closed, and we were able to keep that clinic afloat and keep it running. So we have a very close relationship with Johan van Hove and Dr. Austin Larson at Children's. They see both children and adults at Children's Colorado, so we have a pretty unique relationship there. Ironically, our major form of support has been a bike ride in collaboration with Children's Colorado. We've been doing this bike ride for about 9 years. It's a grassroots fundraising initiative. This year we will hit $1 million in sole support to the mitochondrial clinic. Last year we raised $148,000. Every year we just keep getting bigger. As a result, continuous financial support of our clinic at Children's has enabled us to be the recipient of an NIH grant to help support Dr. Van Hove's research within fibroblasts and mitochondrial function. When we got this grant, I told Johan, I said, oh good, I don't have to get on a bike anymore. And he was like, oh no, you keep getting on that bike. So we're very excited about our partnership there. This year in 2020, as we continue to grow, we're an NFP that started with 2 sad moms to now having significant patient and clinic support. We're grateful to our partners in the space. Grateful again to MitoAction. Wanted to point out we're so grateful to Stealth for the work that they've done this last year, and to all of you. Let's just keep fighting the good fight.
Thanks, Heather. We really appreciate it and all your efforts to grow the support in on the West Coast. So we appreciate it and all your hard work.
Thank you. Thanks for all that you guys do.
Yes, thank you for joining us. Next we have, I think we've got Amanda Baylog now on from GeneDx. Amanda, are you unmuted?
I think so.
Wonderful.
Can you hear me?
Yes.
Okay, great. Thank you guys for inviting me and GeneDx to speak today. For those who don't know us, GeneDx is a geneticist-founded genetic testing laboratory in Maryland. And for our Mito program, we really focus this year on growing our mitochondrial genome testing menu. Of course, we continue to offer whole exome sequencing with mitogenome and a number of other panels based on patient symptoms, but we're really excited about the new test offerings that we developed in the last year. We want to thank the clinicians and patients who really helped us with the development of our mutation testing in urine. It sounds odd to do genetic testing in urine, but for our Mito patients, this is really important because for some patients, this can reduce the need to have a muscle biopsy. And just from launching it this summer, we've already made a number of diagnoses in patients who otherwise would have had to have a muscle biopsy. In addition, we've also developed a rigorous way of looking at mitochondrial genome variants, and especially novel ones or ones that haven't been published before, and deciding whether or not they're disease causing. And we base these criteria off of the ACMG criteria for nuclear variants. And our clients and patients have really found that this provides a lot more information in the reports about patients in the literature and patients that we've seen here at GeneDx. We have also launched Lieber's hereditary optic neuropathy panel that has really gone beyond just the common variant testing, but includes some rare mutations. And we also report heteroplasmy levels. And this reporting of heteroplasmy, or the percent that a mutation is there in, has really proved important because we've actually made some diagnoses in patients that have lower levels of heteroplasmy that have been reported in most patients. And of course, we continue to offer our nuclear optic atrophy panel, which has the highest diagnosis rate of any of our nuclear panels. But that is our newer test offerings, and I hope everyone had a good new year and will have a good 2020.
Thanks, Amanda. I appreciate it. And as always, we know, the diagnostic piece of this journey can be the most difficult. So we appreciate all the hard work that GeneDx puts into every year to developing the diagnostic testing to make that process easier for our community. So we appreciate it. Next, we have Brittany Hernandez, Senior Director of Policy and Advocacy for the Muscular Dystrophy Association. Welcome, Brittany.
Hi there. Hi, Kyra. Can you hear me?
We can hear you, yes.
Okay, great. Thank you.
Oh, I think Brittany's having some technical difficulty. Brittany.
Can you hear me now?
Now we can hear you. There we go.
Okay, I'll get into it. So again, my name is Brittany Hernandez. I'm the Senior Director of Policy and Advocacy for the Muscular Dystrophy Association. As most of you probably know, MDA is an umbrella organization. We cover 43 different neuromuscular conditions and all of their subtypes, including conditions like mitochondrial disease, ALS, SMA, Duchenne muscular dystrophy, and many others. MDA is the largest funder of neuromuscular research outside of the U.S. government, and it's something that that we're very proud to continue funding this kind of research. As many of you may have heard, we recently brought on a new Chief Research Officer, Sharon Hesterly, and we're really thrilled to have her on board as of the end of year last year. We are continuing to roll out our Neuromuscular Observational Research Data Hub, also known as MOVER, at many of our clinics across the country. This is clinician-entered data on the patients that we see. As I'm sure most of you are aware, MDA sponsors over 150 clinics at a number of different institutions across the United States, including in Puerto Rico. We have an upcoming clinical and scientific conference in March from the 22nd to the 25th in Orlando, Florida, which I just like to flag for this group. We'd love to see anybody there. If you have any questions about it, you can feel free to get in touch with me. The information on that conference is available at mdaconference.org. I'm on this call because I know Kyra pretty well through a lot of work that we've done together, specifically in the PFDD space. And so my role at MDA really encompasses everything around policy and advocacy work. We really see ourselves being an umbrella organization as a convener for the neuromuscular community. Obviously there's a lot of issues that we undertake just for MDA, but we also want to create opportunities for collaboration across the space. So I'll just kind of run through a few of those opportunities, and then our outlook for 2020 and going forward. So we have an advocacy network. We recently just brought on a new advocacy engagement manager tasked with organizing our grassroots network. You'll be seeing, if you are signed up for the network, and if you're not, you can go to mda.org/advocacy to do so. We're seeing a lot of different grassroots, grasstops opportunities out of us in the coming months. We also collaborate with other organizations, including MitoAction and UMDF. We recently collaborated on a PFDD meeting. We did one for the CMT community in collaboration with HNF. And we're also leading a Pompeii meeting, and we'll be collaborating with the FSHD Society on their upcoming meeting later this year. MDA hosts something called the Neuromuscular Advocacy Collaborative, which we launched in 2018, which is it's an opportunity for other advocacy-focused organizations in the neuromuscular disease space to come together on issues of agreement and importance, where, oftentimes some smaller organizations may not have a policy department, so we can kind of offer that support and federal engagement opportunities to them. We recently sent a letter to the Hill from a number of members of the Advocacy Collaborative on the issue of access to genetic counseling services, and we're putting together some more opportunities for them to engage on throughout the next year. For 2020, we've kind of drilled down into what our advocacy priorities are into three different sections. The first one is access to care and therapies from day one. As everyone on this call knows, early detection and intervention are absolutely critical to the Mito population and the rest of the neuromuscular disease community. So improving access to genetic testing, counseling services, and things like newborn screening are of high priority for MDA. We're also laser focused on access to care issues, including maintaining patient protections of the Affordable Care Act, maintaining robust insurance programs, including Medicare and Medicaid. And we work a lot with not only other groups across the neuromuscular disease space, but also across larger patient advocacy coalitions. We're very involved in work both on the state and federal level to maintain pre-existing condition coverage protections. Our second issue of importance for our 2020 priorities is obviously therapeutic development. We will be, involved in user fee reauthorizations. My colleague Paul Melmeyer really handles these kinds of issues. We're going to be, looking at ongoing and expanding work and developing policy proposals and collaborations for the user fee reauthorizations. We will look to partner with a number of relevant patient and biopharma organizations, both in the larger neuromuscular space and in the Mito space on these efforts. The third bucket of policy priorities relates to empowerment and independence. One of the issues that we have heard being an umbrella organization with such a broad constituency and diverse constituency is that things like accessible air travel and employment opportunities are something that apply to everyone with a mobility issue or disability. And so we've put a lot of effort and are continuing to put a lot of work into things like accessible air travel. We're also working on promoting Senator Casey's disability employment legislation, which is a topic of interest at our recently Public Policy and Advocacy Conference in October. So we have a lot going on over at MDA, especially in the Policy and Advocacy Department. Obviously, most of the things that I've touched on are really specific to my department's work, but you know, my many counterparts across the organization, we all have an open door, and so I'd offer myself up as kind of the front door for MDA anytime any of you on this call or your other partners and collaborators have any questions about what we have going on or ways to work together. The best way to get in touch with us is advocacy@mdausa.org. That's the advocacy email account. Again, it's advocacy@mdausa.org. Many thanks, and I hope you all have a great day.
Thanks, Brittany. I appreciate it. And we look forward to attending the conference in Orlando as we have for the last couple of years and continuing.
Wonderful. Thank you.
Absolutely. And continue to partner with MDA throughout the year. Next up, we have Alex Dornbaum, who is the Chief Medical Officer for Reneo Pharmaceuticals.
Can you all hear me well?
Yes, we can. Welcome.
Excellent. Thank you for inviting Reneo to participate in this Mito Town Hall meeting. I'm Alex Dornbaum, the Chief Medical Officer at Reneo. We are a small company. We started operations about 2 years ago with the goal to improve the lives of patients with genetic metabolic myopathies. Our company is located in San Diego and outside of London. And although we are a small team, most of us are fairly senior and we have significant experience in all aspects of drug development. As you all know, developing new drugs is a long and a very expensive process. And our strategy is to begin at the middle by identifying drugs previously advanced into the clinic by other companies that have not moved forward because of economic or business reasons. Usually, these drugs were intended for common diseases such as diabetes. We look at how the drugs work, and based on that, we focus on a rare disease where the drug may be effective. And a real advantage of doing this is that when we have the benefit of being able to use the information that was gathered by big pharma to move quickly into clinical trials, we can do this rapidly, and we have a good chance to be successful. REN-001 is one of those drugs. It's a potent and selective activator of the PPAR delta receptor. This receptor controls many functions of the mitochondria in the muscle. In animal studies, when you activate the PPAR delta receptor, you increase mitochondrial function that results in improved exercise endurance. And we've done experiments in human cells using the cells outside the body, and REN-001 in those experiments activates PPAR delta, and it improves the function of the mitochondria. So to date, we have completed 3 clinical studies in over 80 healthy volunteers, and in these studies, we were able to learn a lot about the medication and how to use it. In all of these studies, REN-001 was considered safe and well tolerated. There were no serious adverse events, and the number of common adverse events were similar between the REN-001 treated patients and those that received a placebo or a dummy medication. We are currently enrolling an early phase study in patients with primary mitochondrial myopathy. Our drug is given orally and once a day. The study includes about 20 patients, and all the patients receive the drug for a total of 3 months in the first part of the study, and then some patients in the second part of the study will continue taking the drug in an open label extension for several months. The study is being conducted in 2 centers in the United Kingdom, both in London and in Newcastle. The main goals of the study are to evaluate first the safety and the tolerability of REN-001 in patients with primary mitochondrial myopathy, but the study also includes tests to evaluate if REN-001 can improve how patients feel and how patients function. So far, we're very happy with the results that we have seen in this study, and once we finish the trial, which we think is going to be around the middle of this year, we plan to review very carefully the results, and we are currently working towards starting a larger study at the end of this year. The next study will enroll also adult patients with primary mitochondrial myopathies, and this study will be conducted in several locations in the United States, the UK, in Europe, and probably other countries as well. Now, since we believe that REN-001 can improve energy in muscles, we're also exploring the drug in 2 other rare genetic myopathies. We're doing a trial in fatty acid oxidation disorders and a study in McArdle disease. The fatty acid oxidation trial has been cleared by the FDA and is currently actually already enrolling in clinics in the US. And the McArdle disease study is also active, underway, and it's mainly done in Spain and in the United Kingdom. At Reneo, we understand that finding safe and effective treatment for patients with primary mitochondrial myopathies is very difficult. We have been working with patient groups on all of our clinical indications to encourage input in the design of our studies and to understand the patient journey per se. We believe that we have the best chance to succeed if we work closely with patients, with families, with doctors, with scientists and regulatory agencies, and we plan to continue to work with patient advocacy partners, many of whom are here today in the call, in this call. So, on behalf of Reneo and myself, I want to thank MitoAction for organizing this meeting and inviting us to take part. We also thank all the other advocacy groups who work tirelessly to represent the interests of the patients and the other pharmaceutical and biotech companies that are working to develop drugs and approaches to treat mito diseases. I believe that learning together, we can improve the chances of finding successful treatments. Thank you, everyone, for this opportunity.
Thank you, Alex. We appreciate it, and kudos to the team at Reneo for all of your hard work. And we look forward to hearing more about the trials that you currently have undergoing. Our next speaker is Dr. Richard Bowles with mitochondrial molecular medicine. Welcome, Dr. Bowles.
Thank you for having me. The main thing I'm going to talk about is whole genome sequencing because, I mean, we started off with single genes and then panels and then large panels and then exome. Whole genome sequencing is not only when you sequence all 23 or so thousand genes in the genome, but all of the DNA between the genome. So instead of the hundreds or so of nucleotides that many tests do, or hundreds of genes, we look at all 23,000 genes, all 3 billion nucleotides. Many think that it is more of a investigational or experimental, but it is being used in clinical context by many people. I use it as the main test that I do on essentially all of my patients, usually, but not always, getting a trio where you sequence the patients as well, because you're looking for new mutations that are absent in both parents, and those are actually not extremely rare. Currently, I use the lab variant YX, and the second talk after mine will be Dr. Stanley from that lab to go over more about what they do. But the main thing is that with whole genome, you get everything. You also get the mitochondrial DNA, which is a separate test in most labs. You get structural information, which is better than you would get from a CMA or a chromosomal microarray. You get all the trinucleotide repeats, such as Fragile X and many others, many of them that cause different types of movement disorders. And you also get pharmacogenomic information so that you will know which genes are, if you have any genetic variants which are likely to affect the ability of a drug to work in a patient and what dose should be used. So it really does everything. The other thing is, and I've mentioned this before, is a lot of patients with mitochondrial disease have a monogenic cause. They have a mutation in a gene, and that's the cause of the disease. But in many, it can't be found even in whole genome sequencing. And a lot of times it's polygenic, like most disease in humans is polygenic, is that there are different variants in different genes and that they all predispose towards disease. And there can be environmental components as well. So when you do all of the sequencing, you just don't stop when you find something that looks important. That may not be the most important part of the disease, and it certainly may not be the most treatable one. So in terms of logistics, mitochondrial and molecular medicine is my private practice, which I'm speaking to you from right now in Pasadena, California, where I see patients in person. But I'd say about half the new patients that I see and most of the follow-ups are now by telemedicine. speaking from exactly the same computer I'm speaking from now. And that's working really well. I do telemedicine in several different states. There's a peer-to-peer program that I have through CNNH in New Jersey. That's the Center of Neurological and Neurodevelopmental Health. And in that program, we can help the physician to order the right test, get negotiated rates to get cheaper rates on some tests from some companies, and go through the patient to really discuss the patient and understand it, and then go through the genetics with the physician. And if the family is in a state where I have a license in, the family can also be on that on the telephone call or the telemedicine call. This became really important because I was working for many different companies, including Cortigen and then Lineagen. And I know from a fact that as a geneticist at one of these companies, you just simply don't know the patient very well. You might have some information of the patient, you might even have a note, but you really don't know that person as an individual. You don't know that family. You can't go back and say, are the fifth fingers short? Is there a family history of high fevers? Does the patient have significant fatigue? Are the thyroid tests negative? You really are sort of blind on that. But the vast majority of physicians can't look at a 3 billion sequence and be able to interpret it or make anything out of it. So you really have to connect the phenotype or the patient to the genotype, the DNA sequence. So what we do is we help the physician to order the right test, and then we get on the phone. I've already looked at some of the information, particularly clinical notes and labs. I've already looked at the DNA sequence, and we discuss the patient. So I really feel I get to know the patient. We discuss the sequences so the doctor understands what I'm looking at, and then we talk, what is likely, what fits, what really doesn't fit. We can go over the chart, we can go over labs, and oftentimes, usually the family is present on the call so that they can get the nuances, and we can ask the questions, or I can even look at the patient's face if it might be a syndrome. So that's working really well. And when we connect the phenotype to the genotype, diagnoses are far more likely than they are in the literature, in which the lab and the family are very distant from each other. And well over 50% of the time, we can make an exact diagnosis. A lot of times it's a mitochondrial protein or something else in metabolism, but an ion channelopathy is probably as common or more common in the mito population, and that causes a secondary mitochondrial dysfunction. And they're treatable. It's not just cocktail or whatever, but also there are drugs for that help. Neurotransmitters, many other factors that we need to look at. And the other thing that I'm involved with is just really briefly is NeuroNeeds. That's a company in which I own part of it, and it makes nutritional supplements for different disorders. We have 33 ingredients and spectrum needs, 20 of which are part of the mitochondrial cocktail. The rest are a very high-powered multivitamin with minerals. And that is actually working really well in my mitochondrial population. So that's spectrum needs from NeuroNeeds. And with that, I'll leave it back to you. This has actually been an exciting decade that we just completed.
Yes, it has. Thank you, Dr. Bowles. I appreciate you sharing. On the schedule next, we have Andrea Schatz, who is Director of Market Development for Modus Therapeutics. Welcome, Andrea.
Thank you, Kyra and MitoAction, for inviting me to speak with you today. As Kyra said, my name is Andrea Schatz. I am the Director of Market Development for Modus Therapeutics, a wholly owned subsidiary of Zogenix. Today I'm going to talk about thymidine kinase 2 deficiency, or TK2D deficiency. TK2 deficiency is an enzyme deficiency that results in mitochondrial dysfunction, leading to inadequate energy production in cells. With TK2 deficiency, less mitochondrial DNA is being produced. The result is lower adenosine triphosphate production, which means muscles don't have enough energy and cannot function correctly. The more mitochondrial DNA depletion one has, the worse one's TK2 deficiency may be. Thymidine kinase 2 deficiency is a disease with an age of onset ranging from birth to adulthood, but primarily affects infants and children. TK2 deficiency presents as severe and progressive muscle weakness that profoundly impairs movement, breathing, eating, and other normal functions and is often fatal. Symptoms can include muscle weakness or myopathy, difficulty breathing, droopy or saggy eyelids, trouble chewing and swallowing. There are currently no approved therapies for this disease. Since genetic testing for TK2 deficiency is so new and many other mitochondrial diseases and neuromuscular disorders have similar symptoms of TK2 deficiency, it is thought that there are many more people with TK2 deficiency who have not been diagnosed. Confirmatory diagnosis is made by genetic testing of the blood. Currently, Modis is offering genetic testing for TK2 deficiency at no cost to the patient or insurance carrier, and it must be ordered, this testing must be ordered by a healthcare provider. Modis has partnered with Prevention Genetics Laboratory in the United States to confirm diagnosis for physicians taking care of patients with possible TK2 deficiency. Although the lab is in the United States, we can test worldwide. These patients are often misdiagnosed as this disease resembles other neuromuscular diseases. Modis is developing a drug for investigational treatment for TK2 deficiency called MT1621. MT1621 is deoxynucleoside substrate enhancement therapy to restore mitochondrial function. The therapy has been shown to improve mitochondrial functions and prolong survival in preclinical models, and data from initial clinical studies suggest it may meaningfully alter the course of disease in patients with TK2 deficiency. Please join our TK2 deficiency registry and help take on mitochondrial disease at, hope you have your pencils ready, www.tk2d.com. Again, www.tk2d.com. This website is for patients, families, caregivers, and healthcare professionals. This is both an educational website with advocacy resources such as MitoAction, UMDF, and many more, as well as a way to communicate with the TK2 deficient community. Thank you and Happy New Year.
Thanks, Andrea. We appreciate that. And again, if you have any questions after this call, you can get the information about Modis Therapeutics and their program on the MitoAction website as well. So thank you so much for sharing. Next, we have Christine Stanley, who is the Chief Director of Clinical Genomics for Variantix. Christine, are you on here? I think we're having trouble. Unmuted.
I'm on. Jennifer Hogan should be joining me.
Okay.
Is she on? Jennifer, are you on?
There we go. She's unmuted. She should be good.
Okay.
Yes. Can you hear me?
Welcome, ladies.
Hi, welcome. Are you able to hear me?
I can hear you both. Yes.
Okay, good. So yes, thanks, Kyra, for the invitation to join today. I'm going to be speaking for Variantix. So to start, since this is our first year participating in the MitoTown meeting, and not everyone may be familiar with Variantix, I wanted to use our time to tell you a bit about who we are and what we do. So my name is Jennifer Hogan. I personally handle the communications and outreach at Variantix, but I work very closely with my colleague Christine Stanley, who's online, who first introduced me to MitoAction. Christine is our Chief Director of Clinical Genomics. She oversees clinical genomic interpretations for our lab. She develops the standards for identifying and reporting the relevant causal variants, and she personally has a lot of experience working with mitochondrial disease cases. More specifically, as Dr. Bowles introduced a few minutes ago, Variantix is a genetic testing lab that uses a technology called whole genome sequencing, or WGS for short. And we use that to provide comprehensive testing for genetic disorders, including mitochondrial disease. So we're often asked, what is whole genome sequencing? We already touched on this a bit, but with a whole genome sequencing approach, we're looking at an individual's entire DNA. So this is a little different from other approaches that look at only one very specific region of DNA, either from a single nucleotide to perhaps a single gene or a little bit larger number of genes. And we specifically use whole genome sequencing because when we look at the entire DNA, that gives us a few advantages over other approaches. So first off, we can comprehensively look at different types of variants. Variants being changes that are found within our DNA that can cause disease. We can look at variants in both nuclear and mitochondrial genes. And we can also look at very small variants all the way up to very large variants and even very complex variants. And all of these, as was previously indicated, can be important for diagnosing mitochondrial diseases. Secondly, because we use so many different variant types can be looked at with whole genome sequencing, there's no need to draw blood multiple times and run multiple different tests. We can run one test and we can be done. And lastly, the data can also be reused at any time. If the test is initially negative, we're able to go back and reanalyze the data again in another year or another 2 years when there's even more information that's been discovered and published in this area. Traditional genetic testing usually starts with small targeted tests, and then if nothing's found, another sample is collected and a broader test is performed. And if still nothing's found, yet another sample is collected and an even broader test is performed. But with whole genome sequencing, we start with all that data up front, and then we can select out the specific sections to look at as needed. So the name of the test that we provide is called Genomic Unity. This test shows the specific sections or looks at the specific sections of data that are going to be relevant for a mitochondrial analysis. So we're specifically looking at nuclear mitochondrial genes, both for small sequence changes and larger structural changes. We're looking at the mitochondrial genome. And if the testing is negative, we have the option to reflex up to the much broader full genome that looks across all of the genes more broadly. In 2020, we're looking forward to working more closely with Kyra and others at MitoAction and the broader Mito community. If you'd like to learn more about the science of whole genome sequencing and its role in diagnosis of rare disease, including mitochondrial disease, you can visit our website or reach out to us by email or phone. We'd be more than happy to talk with you. So thanks everyone for listening.
Thanks, Jennifer and Christine. We appreciate that. And just as a reminder, a couple months ago, Christine did a presentation on one of our monthly Mito expert series on genetic testing, and that's available on our website if anybody is interested in going back and listening to what they do and genetic testing for mitochondrial disease in more detail. So thank you so much both for joining us. And our final speaker of the day, last and definitely not least, is Lindsay Smith, who is the Director of People Against Leigh Syndrome. Welcome, Lindsay.
Thank you, Kyra. As she said, my name is Lindsay Klingon-Smith. I'm the Director of People Against Leigh Syndrome. For those on the call who aren't familiar with PALS, we're a nonprofit based in Houston, Texas, and we were formed in 2013 after Lori and Neil Martin's son, Will, was diagnosed with Leigh syndrome. And in the years since, we've worked to raise awareness of and money for Leigh syndrome to help researchers and clinicians work toward more viable treatments and ultimately a cure. One thing I wanted to mention, and really one of our most successful projects to date, is TRIALS, which is the International Registry for Leigh Syndrome. PALS funds this registry, and it's managed by Dr. Mary Kay Koenig and her team at the UT Health Mitochondrial Center of Excellence. And in a nutshell, the registry is a highly secure database of basic demographic information that's input by Leigh syndrome patients that can then be provided to researchers and clinicians to support IRB-approved research projects and clinical trials. I just looked up the number, and today we have about 129 patients from 15 countries on the registry. So if you or a loved one has Leigh syndrome, or if you have a friend or patient or just know someone with Leigh syndrome and you know they are not on the registry, you can register on our website, which is peopleagainstleighs.org. Quickly, 2019 was a great year for PALS. Just a few of the highlights. We went from an all volunteer organization to having a paid employee when the board hired me to oversee the strategy and manage day-to-day activities. We launched a new website, and we really tried to step up our social media presence and are continuing to work on that. We were officially granted 501c3 status from the federal government, which was very exciting. And in last May, we hosted our most successful fundraiser to date, which led us to join and commit funding to the Lee Syndrome Roadmap project that Brian mentioned earlier. So that was a very, very exciting step for us. In 2020, we'll stay the course and we'll continue to raise funds and raise awareness. We're currently working to lock down our annual event in May, so stay tuned for a save the date on our social media and website and whatnot. We're currently developing a strategy for supporters to help us raise funds through their own events, and we tentatively have a golf tournament on the books in September, which will be hosted by a family that supports PALS, which is very exciting. And like all of our partners, and PALS is fairly small, we're just looking for unique ways to raise funds through corporate sponsorships, grants, and more. Specifically with regard to our funding priorities for 2020, we'll continue to fund trials, the registry that I mentioned. We're obviously committed to the Lee Syndrome Roadmap project, and we're also working to raise funds to support physical therapy and dietitian services to improve quality of life for all patients seen by the UT Health Mitochondrial Center of Excellence. To learn more about us, you can go to our website. I'll say it again, it's peopleagainstleas, LEIGHS.org, or you can always call me or text me at 713-248-8782, and that number is also on our website. Thank you all for your time today, and I hope everyone has a great weekend.
Thank you so much, Lindsay. We appreciate it. So that brings us to the end of today's program. I want to thank all of today's speakers for taking the time to share with the community. As we've heard today, we have an army of clinicians, researchers, advocates, caregivers, families, and more who are all working tirelessly to support the Mito community, bring treatments to market, and ensure that anyone affected by Mito knows they're not alone on this journey. We're here for you to support you in any way you need, so be sure to reach out to us, utilize the resources that are available, and continue to let us know how we can make your lives easier. As a reminder, today's call will be available on the MitoAction website later today and followed up with a written transcript within a couple of weeks. Thank you to everyone for joining us, and everyone have a wonderful weekend.